everyone, in today's video we're going to be going over time-restricted eating and how it might help with diabetes management.
What is time-restricted eating? Time-restricted eating, or TRE, is a dietary strategy that focuses on eating within a limited daily window of 8 to 10 hours. The goal is to align mealtimes with our body's natural circadian rhythms. This means eating during the hours when our metabolism is most active, and then fasting during the rest. Unlike traditional energy-restricted diets or other forms of intermittent fasting aimed primarily at weight loss, TRE is different. It allows people to eat freely within the window, emphasizing meal timing instead of calorie restriction. Research shows that the benefits of TRE extend beyond weight loss, impacting overall metabolic health and improving factors like glycemic control. The focus on when food is eaten rather than how much is consumed sets TRE apart from conventional diets. By synchronizing eating habits with our biological clock, TRE aims to optimize the body's natural processes and promote better health outcomes. This is an example of a TRE schedule, and the key is to maintain consistent eating and fasting windows every day. So, for example, you can start eating breakfast at 10 a.m. For example, Greek yogurt with berries and nuts. Doesn't have to be that. It's not restrictive on what you eat, just when you eat. 1 p.m. would be a lunch. 4 p.m. could be a snack just before dinner. And then dinner would be around 5:30 p.m. So your total eating window is about 10 a.m. to 6 p.m., which is about 8 hours. And then the rest of the time, from 6 p.m. to 10 a.m. for 16 hours, you're going to be fasting. But you can still consume water, black coffee, or herbal teas to maintain your fast.
So now we will talk a little bit more about the importance of the eating interval and how it impacts your blood glucose level. So an extension of the intermittent fasting technique, there is something called the early time restricted feeding, which is another feeding technique that incorporates elements of the intermittent fasting principles, as well as consideration for the body's natural circadian rhythm. And so the key elements of this type of technique is that food is only eaten within a 6-hour intake window, and dinner happens before 3 p.m., followed by an 18-hour fast between feeding intervals. And so what this could look like is breakfast sometime between 6:30 and 7:30 or 8, followed by lunch from 11 to 12, sometime between then, and dinner before 3 p.m. Now they did an efficacy trial on pre-diabetics using this method, and what they found is that many of them reported better impacts on insulin sensitivity, as well as insulin responsiveness, as well as more favorable blood pressure and appetite, because the participants also reported having a lower desire to eat during the night. And so this suggests that in addition to weight loss benefits of intermittent fasting, some elements of the circadian rhythm can also be helpful for those managing their blood glucose levels. And so there are a few considerations that you should keep in mind when timing your meal, but one of the most important things is that meals and snacks containing carbs should always be eaten at consistent times throughout the day. So this allows your body and circadian rhythm to kind of predictably know how to control your blood glucose levels so that it maintains a steady, within a steady range. And so this means no eating meals at erratic times or like skipping meals, as this will make it harder for your body to maintain that optimal blood glucose level. It is also noted that improved glucose tolerance is seen when eating intervals are limited to within a 9-hour window. So breakfast, lunch, and dinner all occurring within 9 hours. And second to that, also breakfast being eaten before 8:30 a.m. and less cases of late night eating. But as always, these tips are just from a general guideline, and it is always important to consider your own body when following and devising your own meal plan.
Okay, so for this section, we're going to be looking at how does TRE affect blood glucose. So we're going to start by looking at this diagram, which highlights the many effects of TRE on the blood glucose regulation and overall metabolic health. By shortening the eating window, TRE leads to an unintentional reduction in calorie intake, usually around 20 to 30%. This often results in mild weight loss of about 1 to 4%. What's particularly important is that this weight loss includes reductions in subcutaneous fat, which is beneath the skin, and visceral fat, which is around your organ. And this is closely linked to improved metabolic health. So TRE also enhances your body's ability to use glucose by increasing glucose and amino acid uptake into muscles, improving energy use and muscle function. One of the most significant benefits is a reduction in fasting insulin and fasting glucose levels. meaning the body becomes more sensitive to insulin and better at controlling blood sugar. Over time, this helps reduce insulin resistance, a key factor in developing type 2 diabetes. Lastly, TRE may improve the function of beta cells in the pancreas, which produce insulin, which further supports healthy blood sugar control, helping prevent type 2 diabetes. Now, moving on to the next slide, we're going to look at a study where researchers examined how time-restricted eating, high-intensity functional training, which is HIFT, and a combination of both impacted inactive women with obesity. Specifically, we're going to look at 3 important markers of metabolic health: blood glucose, insulin levels, and insulin resistance. Insulin resistance will be measured by HOMA-IR in this study. So starting with blood glucose. At the start of the study, all 3 groups had similar baseline glucose levels, around 4.7 to 5.3 millimole per liter. These numbers are in the normal range, but after the intervention, things changed dramatically, especially for those who practice TRE. The TRE group's blood glucose dropped from 4.72 to 3.76 millimole per liter, and the group that combined TRE with the high-intensity exercise, which is again HIFT, saw their glucose drop to 3.72. These reductions are significant in comparison to the group that only did HIFT and had a much smaller drop from 5.32 to 4.57. Let's look at insulin next. Insulin, again, is the hormone that helps control blood sugar, but having too much of it can indicate that your body is becoming resistant to insulin, which will eventually lead to type 2 diabetes. At the start, all 3 groups had relatively high insulin levels, around 13.3 microunits per milliliter. But after the intervention, the TRE with HIFT group had dramatic reduction. They cut their insulin by over 50%, going from 13.5 to 6.75 microunits per milliliter. However, the TRE group and the HIFT group individually saw less of a reduction, with TRE dropping to 10.51 and HIFT dropping to 10.58. These big reductions in insulin mean that the participants' bodies became more sensitive to insulin. They needed less of it to control their blood sugar. This improvement in insulin sensitivity is a big win for preventing or managing insulin resistance. Finally, looking at HOMA-IR, all 3 groups had values of 2.9 at baseline, indicating significant insulin resistance. But after the intervention, the TRE and the TRE with HIFT groups showed a major reduction in insulin resistance. The TRE's group dropped to 1.79, while the TRE with HIFT group dropped to 1.08. These are considered healthy values, well below the threshold for early insulin resistance, which is 1.9. In contrast, the HIFT only group had a smaller reduction to 2.13, which still indicates some degree of insulin resistance. What does this all tell us? So time-restricted eating had a significant impact on reducing blood glucose, lowering insulin levels, and improving insulin sensitivity, especially when combined with exercise. The TRE and TRE with HIFT groups saw the greatest benefits, bringing their glucose and insulin resistance back to healthy ranges. This shows by just simply adjusting when you eat, you can see big improvements in your metabolic health.
So now we're going to be looking into the clinical trials. So does time-restricted eating actually work to help with diabetes management? Well, this systematic review looked at 7 different studies of time-restricted eating for pre-diabetics and diabetics, and all 7 studies found that time-restricted eating may be a safe and tolerable dietary intervention, meaning there were no hypoglycemic or adverse events found for patients of pre-diabetes and diabetes, and it may offer cardiovascular and metabolic benefits, such as weight loss, improved beta cell function, improved insulin sensitivity, lower plasma glucose, etc. This study examined how weight reduction and glucose levels varied in type 2 diabetics assigned to eat either 6 or 2 meals per day, but with the same total calories and macronutrients. Both groups had weight and glucose reductions, but the group that ate 2 meals a day had significantly higher weight loss. This suggests that having meals in smaller intervals of the day may aid weight loss, which is a contributing factor to insulin resistance in type 2 diabetes. It is important to note that a separate study by Sutton et al. Found that even if participants don't lose weight with time-restricted eating, there can still be significant benefits for insulin sensitivity, as shown here. As for some tips and tricks for getting into time-restricted eating if you're interested, it is recommended to gradually adjust, so maybe start by fasting from 10 p.m. to 7 a.m. and then increase the fasting period by 30 minutes at a time every few days. And also try to consume lots of protein and high fiber foods to stay full, such as tofu, lean meat, eggs, leafy greens, etc. And it's also important to consider that you need to listen to your body and make sure that you're eating enough within these windows to avoid risks of nausea, fatigue, dehydration, and malnutrition. And also consider speaking to a doctor if you're over 65, pregnant, have a history of eating disorders or low blood pressure, and just be mindful if you decide to give this a go. Thanks for watching this video, and feel free to check out the linked videos to learn more about time-restricted eating or diabetes.